Hi you guys, my name is Stephanie and today I'm going to talk to you about a condition called obstructive sleep apnea. The whole purpose of this video is to educate you on sleep apnea and make you aware of the severity of this condition if it's not treated properly. For those of you who are unaware of what sleep apnea is, it is a serious sleep disorder that causes your upper airway to collapse, causing that air supply to be cut off for as long as 30 seconds. This cycle is repetitive and can happen 400 times a night. Some people that have sleep apnea are unaware that they even have it because while this vicious cycle is happening, they're not waking up fully. But our bodies can sense that breathing disruption that's going on. And how our bodies react to that is our bodies make our hearts beat faster, which results in your blood pressure rising rapidly. Some symptoms you may experience with sleep apnea are daytime sleepiness. The biggest one is snoring, fatigue, lethargy, hyperactivity, or lack of concentration. 1 million people suffer from sleep apnea, and without the proper treatment, there is an increased risk to develop coronary heart disease. David P. White, the sleep apnea director at Brigham Women's Hospital in Boston, states that people with sleep apnea have a 27% increased risk of having a heart attack and a 240% increased risk of congestive heart failure. Treatment options you can do to help with sleep apnea. Losing weight, there's a surgery you can get that removes the tissue that obstructs your airway. But the most common form of treatment is to get a continuous positive airway pressure machine, most commonly known as the CPAP. The whole purpose of a CPAP is it forces air into your throat to help open up your airway. One of the biggest complaints I've heard about the CPAP is the mask. If it's too tight, the straps are uncomfortable around your head. There's a hose that connects from the mask to the machine, which gives you limited range of movement. And I don't know about you guys, but I like to toss and turn sometimes to get in a comfortable position. Fortunately, my office offers a CPAP alternative called an oral sleep appliance. The whole purpose of this appliance is it advances your lower jaw out just a couple millimeters to help open up your airway so you can breathe naturally. We do offer 3 different types of oral sleep appliances, so if you were ever interested, please come on into the Dental Wellness Center in Maryville, and I and the doctors can definitely fit you with the best device. One thing that I really like about these devices is they are not universal, they're custom fit. We use a digital iTero scanner. We wave a wand across your teeth, which sends a digital mold to the lab to help fabricate your own personal custom fit appliance. The ways to treat sleep apnea. A couple of those options are to lose weight. There is a surgery that you can get to remove tissue that obstructs your airway. But the most common form of treatment is to get a continuous positive airway pressure machine, most commonly known as the CPAP. The whole purpose of a CPAP is it forces air into your throat to help open up your airway. One of the most common things I've heard about a CPAP is it's intolerable because the mask fits too tight. I've also heard patients say that the straps are uncomfortable, leaves marks on your face. Then also there's a hose that connects from the mask to the machine, which gives you limited range of movement. And I don't know about you guys, but sometimes I like to move around to get in the most comfortable position. Fortunately for my office at the Dental Wellness Center in Maryville, we offer 3 different types of appliances, which are called oral sleep appliances. The whole purpose of this is it advances your lower jaw out forward just a couple millimeters to help open up that airway so you can breathe naturally. So if you're ever interested, please come on in. The doctors can fit you for the device that they feel would suit you the best. The reason why I really like these appliances is because they're comfortable, they're lightweight, you have free range of movement in bed, and when you're traveling, it's not hard to move around. You can just put it in your case and it just goes in your suitcase and you're ready to go. Fabricate your custom fit appliance by using a digital scanner and sending a digital mold to the lab to fabricate this device. If you or a loved one is having any issues with sleep apnea or suspect that you have it, please contact your doctor right away. Once you're diagnosed, come see us. That way we can fit you for your own personal appliance and help you have a healthier and safe life. Thank you for listening to my little tidbit on sleep apnea, and if you have any questions, please call the Dental Wellness Center in Maryville at 618-288-1923. Thank you.